Hello, everyone. My name is Dr. Bryan Sackey. I am a psychopharmacologist currently working at the South Texas Veterans Healthcare System in San Antonio, Texas. I'm currently also the CEO and founder of the PharmC Initiative Leaders organization, which essentially seeks to provide resources to minorities who aspire to be pharmacists and/or pursue careers in that field. Today, I have the pleasure of talking to you all about mental health. It is my pride and joy. Currently in my clinic, I see patients 5 days a week, and I also provide consultative services to other healthcare providers regarding mental health and medication management. So today, not only will I talk to you about just what mental health is and what it means, but I also talk a little bit more about medications and sort of how that integrates into our psychiatric well-being. So first I want to start with, what does mental health mean to you? So just take a few seconds, close your eyes, just visualize, what do you hear, what do you think about, what do you see when someone mentions mental health? Now in society you might see a sad image, someone feeling down, your head is not in the right place, you just feel a bit off, it feels like the wheels aren't turning appropriately, you're just not yourself. Well, these are all kind of different descriptions of mental health. Of course, when we go into more of a granular detail, there are various descriptions of these feelings, right? Feeling down and depressed, it can be actually categorized as a form of depression. But when we actually look at the conditions itself in greater detail, obviously there's criteria that needs to be met to meet some of these conditions, but they all play a role in how we may feel. And it's just a sense of not being, at the most optimal or just a general mental well-being. And we have to be very careful when we talk about that. Sometimes you can feel really, really, happy or on a high. That doesn't necessarily mean your mental health is at the best place. It's sort of a balance and trying to understand, and getting a grasp of what a good mental health looks like. Now, for us to better understand what mental health is and sort of describe what it looks like, I want to illustrate this with a few patient presentations and kind of better describe what we're dealing with here. So our first individual we have here is Mr. James Neymar. He's a superstar soccer player for the Ghanaian Black Stars. Now I'm from Ghana, so I actually had, I had to definitely put them on. But so this is a great soccer player. He's doing great, he scores all the goals. He's amazing. One day at practice, though, breaks his leg. Doctor looks at it and is like, yeah, buddy, this leg is broken. So what does James do? He does everything he needs to do to get better, right? He gets rushed to the hospital. He may need crutches. He may need surgery. You may determine, like, hey, you have to keep this on in order for your leg to heal. Different assistant devices. May need medications, antibiotics, things to keep it unaffected, to keep it at a clean source so that it can properly heal. And sometimes it may do rehab as well. That would help to assist it and get back to where it needs to be. So over time, there may be different, tools he may need to use, like wheelchairs. Of course, the support of his friends and family, being there to help him through this process is going to be very key. Eventually he'll start to slowly get back to where he is, and then he'll be back to, good old James, ready to go. Now let's switch gears here. Let's meet Essie, right? So Essie, she's a 36-year-old female. She just gave birth to a beautiful newborn. Just in general, her life is great as relates to her job, very stable, well-paying, husband is supportive, great circle of friends. However, over the last few weeks, her friends noticed that her mood has changed. She's not been talking to them as often. She's been isolating herself. She hasn't been eating appropriately. She hasn't been sleeping right. She can't concentrate. She just constantly feels down and just pessimistic, just not really able to do the things she normally does. So now that brings us to just the concept of an injured mind. What about when our minds are injured? Now, of course, we looked at two very different individuals. However, they honestly really present with the same dilemma. With with James Neymar, he has an injured leg, so he can't function or do things he normally can do with this impairment. And the same thing with Essie. Essentially, her mind or her brain may be injured, quote unquote, and may not be exactly where it needs to be in order for her to operate and do things that she normally does. So, in a sense, there's some level of impairment in both of these individuals, and they're really not able to be themselves fully. And so, just like James, Essie may need to go through certain different things to get back to kind of a good level of functioning. This can include counseling or therapy, maybe medications, and just like James, the support of family and friends to help you through this process is very, very critical. Um, this is something I like to always present because we tend to neglect the fact that mental health is an actual condition. You know, is the problem with mental health is we can't see it, so it's hard for us to visualize something being injured, right? It's like how can you say something's wrong? You look perfectly fine. It's the disease, the invisible disease. You can't really tell what's going on in someone's mind, and what's worse, we try to mask it. So imagine Neymar trying to walk on this broken leg, right? Trying to mask this broken leg. There's no way they can function the way that they hope to be. So when we look at just various mental health conditions, we have anxiety, depression, schizophrenia, so many different types. Some of them that I alluded to earlier. Now, of course, we can look at just a state of not being mentally well, right, or not being where you want to be. There's an anticipated response to certain things that may make you experience some of these quote unquote conditions, right? You're expected to feel a level of anxiety when you have a test coming up. You're expected to feel some level of depression or just feeling down when someone passes away. However, when it gets to certain points whereby it affects your daily functioning and or lasts for a considerable amount of time where you're not able to function to your normal capacity, then we start to consider this to be conditions that warrants treatment. And so in our practice, we often use what is called the Diagnostic and Statistical Manual, 5th edition, or DSM-5, to help us characterize these conditions and sort of describe or distinguish whether this is an actual mental health condition that we need to treat, or is this sort of a temporary feeling or natural response to something that a patient may go through that we kind of sort of just wait and watch and see to allow it to pass. Now, this is affecting 15% of our population globally and amounts to 970 million people worldwide. So, very considerable. Now, when we look at the various conditions breakdown globally, we see anxiety disorders being the most prevalent, followed by depression, alcohol use disorders, as well as other drug use disorders. Then we have bipolar, schizophrenia, and eating disorders. Now, this, of course, is not all encompassing. There are other conditions out there like PTSD and so forth. But the key thing here is, although these numbers may seem small or even, it just more than you may even thought it could be, it still doesn't really capture what's going on because, again, this is quote unquote the condition that is often hidden or never really reported. So if you don't essentially recognize or willing to seek help for what you're experiencing mentally, there's no way it can be recorded. So I anticipate that these numbers are much higher than it's really presented here. And especially with COVID and everything that's going on now, there's a lot of mental burden in trying to adjust to this new way of life. So that's something to be considered as well. When we look at a map globally of the mental health conditions and their prevalence in various countries, the darker colors represent higher severity of or more prevalence of a mental health condition. So we can see here a lot of these, the first world countries, the Americas, the Pacifics, Australia here, they do have a considerable amount of mental health diagnoses there. Now, though you may see lighter colors in areas like South Africa or in Africa and Asia, even a lot of these third world countries, it may not necessarily reflect the true amount of mental health condition, and that may be impacted by cultural factors. Certain countries culturally, they may not really want to talk about their mental health or present it or believe that it's an actual condition. So really, it's not really recorded, and they're just suffering in silence. We kind of just further looking at this, you can see here that a lot of these countries, again, West Pacific, America, Southeast Asia, they account for the highest amounts of depressive conditions. This figure here gives a nice description of how, some of these factors like low income can actually play a huge role in suicide, unfortunately. So this figure here just essentially describes how lower income countries are more likely to commit suicide. So we talked about, the prevalence in various countries, and we do see a high prevalence of just mental health conditions in these first world countries. But suicide rates are still quite high, especially in these lower income countries. So that kind of describes to you how people are suffering in silence. Excuse me. However, they may not report it or try to seek care, and then it becomes a little too late. So it's very, very, very key for us to be able to focus and get an understanding of what's going on mentally and be able to impact those individuals globally. So we're talking about 788,000 people dying of suicide, particularly in the year 2015. Right now, it's considered to be a top 10 leading cause of death in the United States. So this is definitely one that we want to pay attention to and continue to monitor as we learn more and more about these conditions. So what are some risk factors? A lot of times we tend to think, or at least in society, there's just perception that mental health is or mental illness is just all in your head. It's just your inability to cope with stressors or conditions. However, what we've learned to understand is that it goes way beyond what you may have experienced, what you're going through at the moment. A lot of the factors, a lot of things that may contribute or may be associated with the likelihood of developing a mental illness can be attributed to things that you may have went through, your genetics, medical conditions, predisposing factors like your socioeconomic status, your income, certain substances you take that can alter your mind. These are things we have to think about. So it's not just the moment in time. One person A can, experience a death in the family, and person B can experience a death in the same level of death in the family, but person B may develop depression, and that may be as a result of their upbringing, their genetics. If their mom had depression, they were more likely to develop depression, and so forth. Medical conditions is something I like to highlight as well. So there are certain conditions like, if you have Parkinson's disease or even migraines, even seizures, there is actually a higher chance of experiencing depression, anxiety, and so forth. So that's something also, again, that we don't consider but plays a huge role. So how does depression present? Usually, when we talk about depression, we're talking about late 20s. Usually is when they present. A lot of times it's triggered by a major life stressor. With treatment, we're talking about 20 weeks. Now, depression is something that comes in episodes, right? This is clinical depression, right? When you're diagnosed with actual major depressive disorder. They tend to come in episodes. Now, if you do treat it, most of the time it can resolve within 20 weeks. That doesn't mean it would never come back, but with just aggressive treatment or just paying attention to it and attending to it as early as it presents, you're less likely to have it last as long as 6 months, which is where we start to look at the untreated cases. And with each episode, you're more likely to experience another episode. So the risk of recurrence occurs every time you have an episode. So it's very important to treat it as it comes. So only about 50% will have one episode and never have a recurrence. The other key thing here is suicide. So obviously we talked about how it's very important to recognize that suicide can come about with some of these conditions. The key thing that I always point out to my patients is that suicide doesn't end the chances of life getting worse, but it does eliminate the possibility of it ever getting better. One thing I want to point out here is that we often try to paint suicide as this selfish act, or you know, it was a form of weakness and that's why the person took their own life. That is not the case. What we've learned about suicide is that they are a byproduct of a lot of these mental health conditions. Oftentimes, these are uncontrollable thoughts that come as a person is dealing with depression, anxiety, or bipolar, schizophrenia, what have you. So it becomes less so of a decision that they're making voluntarily. Of course, it's their action. However, the ability to control it is actually part of the condition itself. So it's much more difficult than we like to think. So something to consider whenever we hear suicide, and hopefully with education and support, we're able to help people who do have these thoughts through it. Siggy caps is something that I like to acronym I like to use to help remember the various symptoms of depression. So we talked about Essie, if you remember her in the beginning. A lot of things she experienced were, low energy, less motivated, isolating herself, poor concentration. That's essentially what is happening here when we talk about depression. So these are the hallmark symptoms. Siggy caps you can see listed there kind of helps to keep me kind of aligned and remember the different conditions. We have sleep disturbances, loss of interest or pleasure, guilty feelings, changes in energy, concentration, appetite may change, it may go high or low. You may have this what we call psychomotor disturbances. That's where you either can think really or react really slow to things, or be extra fidgety. And of course, we have suicidal thoughts. So these are things to keep in mind. If you notice these changes in yourself or other people, it might be reasons to check in on them and perhaps advocate for them to seek mental health care. Now, of course, it doesn't mean if you have these, you have depression. You want to rely on a healthcare provider, professional to properly diagnose. So we talked about all this, depression. It looks like this, it presents like that, but is it all just in our head, or is there something really happening in the brain that's causing this? I'm glad you asked. There are actually chemicals involved in the way that we are operating, right? So we talked about James Neymar in the beginning, broke his leg. So, bone is broken. It's not attached the right way. Ligaments may be torn. Sorry to be too gruesome, but there are actual physical changes that's impacting the way a person's able to walk when their leg is broken. Mental health, there are actual chemical changes that impacts the way a person is able to think and operate. Three that we mainly look at when we talk about mental health conditions are serotonin, dopamine, and norepinephrine. These are what we call neurotransmitters, which are just fancy for various for chemicals in our brains that help to communicate from one end to the other. Now, if we look through the various neurotransmitters, we can see here a lot of it actually is associated with the things, the impairments that we see in depression, right? So serotonin, for example, you see memory concerns, or it impacts memory, impacts appetite, anxiety as well. Dopamine can impact motivation and your drive, just the ability to feel rewarded or pleasure from things. Norepinephrine is playing a role in your concentration, your energy, and attention. A lot of these things, again, when it's impaired, you can see that our mood or our cognition, our ability to think and process things, is not the best place. So to further describe that, what's happening? So normally we have these neurotransmitters, like we mentioned, dopamine, serotonin, norepinephrine. They go from one end of the nerve to the other in our brain, helping to communicate, helping to kind of regulate all those things we just talked about. Now, when we're dealing with something like depression, they tend to be reduced. Now, of course, we're focusing here on depression, and there are various other different pathways or different things that may be dysfunctioning when we talk about other disease states like bipolar and schizophrenia. But when we specifically focus on depression, and often actually anxiety and some of the traumatic conditions, this is what's often occurring in our brains. So by nature, we try to help to increase that or improve that. And that's where the medications come into play, as well as non-medicational approaches. One thing that we have to keep in mind is that, we don't always have to jump to medications, and we'll talk about that in a second. We tend to often try the non-medication, non-pharmacological routes of treatment. And there are studies that show that these can help to increase those neurotransmitters, the communication, and help to fix some of the long-term damage that may have occurred as a result of certain things we may have gone through, or just even genetically predisposed conditions. So this can be therapy, getting a counselor, getting a therapist. We have what is called electroconvulsive therapy, which essentially it's a procedure where it sends certain shocks, little minor shocks to your brain to help release those chemicals we talked about. There's other special devices. Then, of course, self-care. This is what I always advocate. What can we do on our own to help keep our mind in the best way, best shape possible? Sleep. You want to get at least 7 hours of sleep per night. You are what you eat. What you put in your body is going to directly impact your brain functioning. Exercise is going to play a huge role. Actually, exercise helps to send oxygen to your brain, which helps to keep a healthy amount of those neurotransmitters going in our minds. Spirituality plays a huge role. So it's not just, hey, I'm gonna hope that everything goes okay and just kind of rely on these things. Spirituality, keeping a nice, well balanced spiritual relationship, which includes social support, is known to be helpful for keeping our minds in the best shape possible. And of course, avoiding certain substances that can only kind of cloud our judgment, especially when we use it in excess. So it's okay to use things, socially, not here to judge that. When we start to depend on these substances, we're unable to keep our minds in the most healthy shape possible. So now medications, this tends to be this kind of enigma, this nebulous, don't talk about it, don't go the medication route, we don't know what it's about. I'm here to talk all about that for you. I'm here to provide clarification and discuss, what role they play in mental health. So I'll kind of go through some of the misconceptions that I often encounter and provide you the accurate truth. So the ones highlighted in red here are some of the things I commonly see and hear, which aren't necessarily true. The first one we have here is psychiatric medications are addictive. In actuality, the truth is most are not. So they often are used to help treat the conditions, or they are used to treat the conditions, but we're not going to see situations whereby, like, with opioids, where your body forms a dependence on them. If you need to come off, you can come off, and that's perfectly fine. However, it is important to talk to your doctor about what side effects you should expect. But nonetheless, don't expect you to be addicted to it once you start it. You can easily come off of it when necessary. Next one I hear is my medications should kick in right away. It should just start working as soon as I take it. Truth is, for antidepressants specifically, it takes quite a bit of time, about 4 to 6 weeks. And that's mainly because the neurochemicals that we talked about, the transmitters, your brain is slowly adjusting to this, these changes. So it doesn't happen overnight. You kind of need your brain time to adjust. And that's a healthy way of healing. And so we shouldn't expect it to happen right away. However, there are certain other ones like antipsychotics, they kind of react or take an effect a bit sooner. So some vary. But for when we talk about antidepressants, a lot of the medications for anxiety, they take some time. So you do have to be patient and take it every day. Take it every day in order for you to see the full effects. On and off, you may not see, if you take it on and off, you're not going to really see the full effects. It's about taking it every day and being patient with the process. We have hey, they don't even work, so why try? The truth is, there has been a lot of studies that proves that medications are effective for medications. Now they vary. Overall, they're around 50 to 60% effective. So when we compare it to other commonly used medications in society, the figure here, the ones on the left, the higher the bar, the more effective it is for the intended condition. Now, just because, say for example, aspirin, which is already all the way on the right, just because it's low on the effective end, doesn't mean it doesn't work. Now, I want to point that out because antidepressants, antipsychotics, they fall sort of in the middle, but the ones to the right of it, the ACE inhibitors, statins, aspirin, those are one of the highest prescribed medications. So doctors commonly prescribe that, and even though they're more comfortably used compared to antidepressants, they're actually not noticed to be as effective as antidepressants for their conditions. So these ACE inhibitors for blood pressure, statins for high lipid and fat levels, aspirins for also for your heart health. They're commonly prescribed, but again, antidepressants, we tend to shy away from it. However, they tend to be more effective for their condition than some of these other ones. So that's something to keep in mind. The other one I commonly hear is they will destroy my liver and my kidneys. The truth is, they rarely cause damage to your liver or your kidneys. When you speak to your doctor about any medication, they should be reviewing your labs, making sure that everything is healthy. But it's important to note with these medications, they're not directly causing damage to your liver or your kidneys. Now, some medications in general, just in general, some do. Now, it's important for the doctor to let you know when we're talking about psych medications, majority actually do not cause damage to your liver or your kidneys. We also have this classic one. Hey, I saw someone say they had a bad experience on Google, so I don't want to take them. The truth is, everyone responds to medications differently. So we really cannot compare how one person would respond to the next. Remember, genetics plays a role. What are the conditions you experience and your outcome, your livelihood, your socioeconomic classes. Those things actually play a role in how severe these mental health conditions are, as well as, especially genetics, how you would respond to some of these medications. So I may take a medication and then have a positive result or just, benefit from it, feel great. Another person may take that same medication and have all these side effects. And the reason why, a lot of times, is related to your genetics, just your genetic makeup. Everyone really, honestly, responds to medications in some level of disparity. We have an expected response, right? We expect them to work to this way and expect to have some of these side effects, but that doesn't necessarily mean one person's experience is going to mirror another person. Another common one is I won't have control of myself when I take it. I hear I'll turn into a zombie. And that is not true. Really what they're here for is to help you better function. I always like to describe medications as providing an ability to better handle stress. It's not supposed to change who you are at the core, so don't expect to take these medications and all of a sudden lose control of who you are, you become a zombie. If that happens, that means the medications aren't doing its job and it's responding in a negative way. Now, of course, that's where you seek your providers, the health professionals, to help you through this. We have to remember that you're not doing this on your own. Part of what I do on a day-to-day basis is actually see my patients on a monthly basis, kind of help them through this process, because it's not a one-size-fits-all. It's not always perfect. You may try one medication and it may not work for you, and you have to make some adjustments. That's perfectly okay. But understanding that you're not alone, and we're here to help you, or just healthcare providers are here to help you, it should help ease any kind of fear you may have in taking medications. So with all of that, what stops a lot of us in society from seeking mental health care? Some may feel like, hey, I'll be weak if I take medications, or if I seek care, or if I'll be called crazy if I actually try to go see a quote unquote a shrink. I might lose my job because they think I'm crazy now. Will they even help? Is it worth it? Or maybe I could just suck it up, or I could just pray it away, which is very, very common. Hopefully what I presented so far can help to dispel all of these misconceptions, because we do know that it goes beyond just, it being quote unquote all in your head. It's a lot of different factors going on that we need assistance to help us through in order for us to function to our best ability. So overall in society, we do see in minorities they're more likely to experience a mental health condition. However, they're less likely, about half as likely, to actually seek treatment compared to our Caucasian counterparts. Oftentimes, African Americans are more likely to be misdiagnosed, which actually becomes a problem. And I think many of these situations are related to just a misunderstanding of cultural concepts of minorities. So you may not be able to fully pull, a healthcare provider may not be able to pull that, what someone does culturally and translate it to what's going on mentally. And that unfortunately leads to some misdiagnosis, and that further causes distrust in healthcare for mental health, and so it further pushes people away. But this is something that, again, as we keep advocating for mental health care and more people learn and educate themselves, we're able to prevent some of these things. We see here that blacks, Asians, Hispanics, other minorities, they're just as likely or least likely compared to other races to use psychiatric medications as prescribed. Many of this is related to historical context, like the Tuskegee experiment. I encourage you to look that up, but there are various factors which may lead to mistrust overall in use of medication, and that further perpetuates the barriers of seeking mental health care. And then, of course, there's the stigmas. Majority of minorities have shown to be more likely affected by stigma, or more likely to be worried that they'll be labeled as crazy and so forth. Again, something we have to educate against. So overall, we have to understand that mental health conditions can occur to anyone. The key thing here is advocating for care, advocating for us to seek the treatment where necessary. Now, I always tell everyone, get a therapist. Even if you feel fine, it's good to kind of just get a checkup, see how you're doing. If medications are necessary, that's completely fine. It's part of your healing process to get you to the best possible version of yourself. I'll leave you with this. One thing that we always hear, or kind of a concept that we often hear in minority populations, when you ask them about, hey, what's going on with you? How's this? How's that? They'll tell you, mind your business. Keep to yourself. Just mind your business. What I tell them is, your mind is my business. I'm here to help you mentally get to the best place possible. And so Your Mind is Our Business is actually an initiative I'm launching as of late. And it is pretty much going to provide resources to minorities as well. So be on the lookout for that. The website will be YMOB, as in boy.org. So I hope to really kind of expound on a lot of things that we talked about today, and hopefully improve the care of minority populations. Thank you all very much. This was very enjoyable. I hope you guys learned and enjoyed as well. And I provided for you my contact information, to include my email, as well as a website that relates to the nonprofit that I run for pharmacists who are seeking further careers, especially minorities who may not have the resources available to them. So feel free to check that out as well. It's been a pleasure. Take care.